psychiatry is broken and we need to be viewed as a real medical specialty with imaging, because if you don't look, you don't know.
So are psychiatrists who are not using brain imaging, by functioning without looking, are they doing a disservice to their patients?
I think they're flying blind.
I'm curious to hear what you guys think, because in the period from 1990 to 1970, something similar happened in physical therapy. There was a big push by a lot of people to medicalize and quote-unquote professionalize physical therapy to get recognition that we matter, that we exist. And this led to some good things, but also some negatives, and I'm wondering if the same is happening here. Just like now in physical therapy, with the strong emergence of neuroscience for pain, but also in the furthering research of the diagnostic relevance of things like arthritis, degenerative abnormalities, or abnormalities in general, we have seen that this often doesn't correlate with the impairment or with pain. Now that begs the question, at least for me, does an abnormal brain mean that it's necessarily a bad brain? And if that is the case, knowing if it is an abnormal brain, does it actually change the intervention? And what I heard from the professor in this interview, it does not really. He still went for lifestyle interventions, he still went for supplementation like multivitamins and omega-3s. So basically anything that makes the human more healthy. Do we need like a special diagnostic or test for that? I don't think so, personally. And I only think that this will make psychiatry less accessible and more restricted and more bureaucratic if it does become medicalized. And let me know what you guys think.